My written testimony says good afternoon. I'll have to amend that if you'll allow me to good evening. My name is Dr. Ben Brown. I'm an obstetrician-gynecologist. I practice here in Rhode Island, and I am a member of ACOG, the American College of Obstetricians and Gynecologists. First and foremost, I am here today to express my strong support for the Reproductive Health Care Act. As my colleagues have already addressed this bill, I will confine the remainder of my own remarks to the other acts under consideration here today. I stand in strong opposition to H5114, H5198, and H5199. In expressing my opposition to these bills, I am speaking for myself and for the Rhode Island chapter of the American College of Obstetricians and Gynecologists. Abortion stirs powerful emotions, and it occupies a contested place in our political debate. Nonetheless, 1 in 4 American women will have an abortion during her reproductive life. Approximately 10% of those abortions will happen in the second trimester after 14 weeks. Patients need abortions for many reasons, and every patient's circumstance is different. When a physician sits with a patient, the physician's sole focus should be on the patient's needs and the scientific evidence about the best course of treatment for that patient. Legislative interference in the doctor-patient relationship prevents physicians from being able to dedicate their energy wholeheartedly to the patient in front of them. To give one example, H5114 would ban the most common second trimester abortion method, dilation and evacuation. Patients require abortion in the second trimester for many reasons, including the development of medical complications like severe high blood pressure or kidney failure in the pregnant patient, or the discovery of anatomic abnormalities in the fetus. If this ban were passed, as a physician, I would be forbidden from offering a patient in one of these circumstances the standard of care if she required an abortion. Rather, the patient would be forced by law to undergo medically unnecessary procedures that would simply increase the risk of her abortion care without any benefit to her health. Some patients might even be forced by this law to undergo an induction of labor in order to access abortion in the second trimester, resulting in longer hospital stay, greater pain, and a higher overall complication risk, including a greater risk of needing additional surgery when compared to a dilation and evacuation. In short, restrictive legislation puts patients at risk. The bans under consideration today are scientifically unsound and do nothing to advance patient safety. On the contrary, we know that when legislators ban abortion, patients continue to require abortion care, but they end up being forced outside the medical system. Now, it is because legislative interference in the doctor-patient relationship has such tremendous potential for harm that the national professional societies of the field of obstetrics and gynecology are clear, direct, and unequivocal in their support for the legal right to abortion. In a recent article, our professional societies affirmed that the environment of legislative interference in the exam room, quote, forces physicians to choose between honoring their professional ethics to provide the best care for their patients and complying with regulations that may harm their patients, risking their personal and professional careers if they do not. This article was affirmed, among others, by the American College of Obstetricians and Gynecologists, the Council of University Chairs in Obstetrics and Gynecology, the Association of Professors of Gynecology and Obstetrics, the Council on Resident Education in Obstetrics and Gynecology, the American Society of Reproductive Medicine, representing infertility specialists, the Society of Gynecologic Oncology, representing gynecologic cancer specialists, and the Society of Maternal Fetal Medicine, representing high-risk pregnancy specialists. Members of the committee, when I sit with a patient, my first priority is the patient's safety. In caring for my patients, I rely on the scientific evidence, my clinical training, a network of compassionate and surgically skilled colleagues, and on the guidance of my professional societies. I want to continue to take excellent care of my patients. Bills H5114, H5198, and H5199 would prevent me from doing so. I urge the committee and the House to reject them. Thank you.
Dr. Kovesi. Good evening.
Good evening.
You and one of the other physicians mentioned about legislative interference in medicine. You believe that's true across the board with everything in medicine or anything medicine related?
I'm not sure I understand your question. Could you clarify?
Are there any situations with regard to medicine and medical practices that you feel legislative regulation would be appropriate?
So if I take your question correctly, I appreciate the fact that we have a Board of Registration in Medicine. I appreciate the fact that we have a regulatory system to ensure that patients get access to excellent care. What I object to is the singling out of a particular type of medical care for a different type of scrutiny than other procedures in medicine. What I can tell you is that abortion has an incredibly low complication rate. It is an incredibly safe procedure, in spite of that, it undergoes a level of scrutiny that is far beyond what procedures that are far more risky to the patient receive, and that's what I object to.
Something akin to eugenics, you would consider legislative regulation or interference would be appropriate?
Again, I'm not sure I understand your question.
Well, if someone was to involve themselves with eugenics, would you feel something of that nature would be appropriate for legislative regulation, control, or interference?
Well, so what I can say is that the practice of medicine is about ensuring the safety of the patient that I'm caring for. And so every situation is different. I would never strive to impose my values on the patient, and I would expect my colleagues to act the same way. It is not at all within the it is firmly within the requirements of the ethics of our profession that we respect our patients' decisions and that we be providing care that is respectful of the needs of the patient and not imposing our own values on the patient.
That's a half answer, but I'll accept it.
No further questions? Oh, sure. Dennis?
Thank you, Doctor. You had indicated that you were not in favor of Bills 5114, 5198, and 5199. Are we to assume that, medically speaking, that you are in favor of 5125 and 5127?
I'm in favor of the Reproductive Health Care Act. I am opposed to the Reproductive Privacy Act.
Thank you.
Thank you.
Any further questions?